Hi, welcome to Nursing School Explained and this video in the Nurse Interview series. And today I'm here with Jim Gordon, who is a fabulous nurse, actually now not actively in patient care anymore, but he is here today to share his experience and his journey in nursing. So hi, Jim, welcome.
Hi.
Good to see you. You have a wonderful view.
And you. Thanks.
So how long have you been a nurse?
I have been a nurse 13 years. This summer it'll be 14 years.
Okay, excellent. And how tell me about that journey into your nursing career.
You know, I tell the story. I never had any plans of being a nurse. I wasn't that guy who was like, oh man, I want to be a nurse. I want to help people. I stumbled into being a nurse. When I was in the military, my last job in my career in the military, I was teaching at the Naval Special Warfare Center. And in between class cycles, myself and a couple other instructors, we had to renew our EMT certificates. We went to Southwestern College down in San Diego, and they probably still have a 3-week renew your EMT cert thing, and we're going through that. And the instructor, he was a paramedic, a little older than I was, and he's just beating up the class, just going through it one day really, really quick. And, you know, slowed him down, and he's like, what's going on? He's like, oh, I got school tonight. And come to find out he was going to nursing school. And up until that point, you know, my plan for when I retired from the military, I figured I'd probably be a lifeguard, drive the bus at the zoo, you know, something like. I never really had a big plan. But I spent, you know, he kind of planted a seed, and I spent an honest six, 7 months just researching. I had no idea what, you know, I knew what nurses were, but I just didn't know all that was entailed in the job. And I spent a lot of time, like I said, maybe 6 or 7 months researching, and finally just made the decision and started taking classes. And by the time I was, you know, fully retired from the Navy, I was a full-time student and became a nurse. I worked at I kind of limited myself. When I graduated school, I wanted to be an emergency department nurse. I knew that environment would work well for me. I don't do well with a lot of free time on my hands. So I need to kind of keep busy, and I like that environment. I like the autonomy of it. I like the kind of problem solving part of it. So that was my big job. I did emergency department nursing. I did some casual relief, trauma nurse team leader. For a while I did an advanced access thing. I was doing midlines, you know, going around the hospital, putting in midlines and ultrasound guided lines, stuff like that. And now I'm a clinical instructor at College of the Redwoods, and I love it.
Amazing. Those students are lucky to have you. So what do you like most about being a clinical instructor?
Well, I love it. I love that you get to be a part in everybody's kind of process and a part of everybody's journey. There's an old saying, you know, somebody asks you to help them with something. You know, in my family, we use it a lot. It's like, you want me to tell you what time it is, or you want me to help you build a clock? And being a clinical instructor, you're helping, you know, 15 students at a time build their clock, and you're teaching them how to figure it out. You know, I could get a job in somebody's emergency department and take care of 4 people. But if I take care of 15 students that are going to go out and be nurses, and each one of them are taking care of 4 people, you know, that's a significant impact. I enjoy that. And I like the teaching process. I like the give and take between the students and the faculty and then the staff at the hospital. It's a lot of fun.
That's great. I have to agree with you. I feel the same way. You really feel that you're guiding them, and especially if you see the growth from the students from their first day of maybe their first day of clinical ever, and then just by the end of the semester, how they really come around and everything starts to click, and then all of a sudden the light bulb goes off. It's just a really great feeling when that happens.
Yeah, I love that. I love that.
So with your military background, I find sometimes there can be a stereotype out there that nursing is a profession mostly made for women. So you working in the Navy and in the Special Forces, what is your experience with that stereotype, or have you experienced that, and has it changed any from when you first graduated about 13 years ago to now?
Oh yeah, absolutely. And it was a concern because not only was I in the Navy, but I was in a part of the Navy that did not have, at the time, females weren't even allowed to try out for what I did. And now they're welcome to try. I don't think any have successfully made it, but and before the Navy, I worked on tugboats and fishing boats and all these different kind of male, dominant kind of gigs. And I was kind of concerned about it, and I just chose to ignore it, just swim my own race. When I got into clinicals, I started seeing a little bit of, the typical places you'd expect, being an older male student, my L&D rotation, OB, postpartum, stuff like that. Some of the nurses didn't care, go over here. And, there was the typical stuff you would tell any student nurse, go do this, go check that patient. No drama. Some of the staff nurses didn't dig the fact that I was there. My final externship, preceptorship, my last semester, I was at a hospital down in Chula Vista on the border and in the emergency department. And it's great experience, but it was a policy of that hospital's management at that time that males didn't put in female Foleys, which was kind of hard on all the female nurses, because it's like, if I have, 3 patients that need a Foley, I have to go find some, hey, could you put in my Foley for me? And I just found that kind of weird. Now, as time's gone on, by the time I left my last emergency department job and came up here, I really didn't see it that much. At first, there was a lot of, hey, could you move my patient? Could you help me lift? There was a lot of, hey, I need you to help me with more physical stuff. And I didn't mind, you help where you can. But as time went on, you saw that less and less. It wasn't, hey, let me go find the guy. It was, let's just do it. It kind of isn't that big a deal anymore. And I see with my students now, because I'm in their rooms with all of them, and it's, there's right now I have 2 different cohorts. One of them has 3 men for 14. The other one has 2. It's the first of this. I'm just coming into my second week of the semester, so I'm still kind of sorting out who's who in the zoo. And I don't see a lot of pushback. It's kind of starting to equalize a little bit. And I think the more experienced the nurse is, the staff nurse or the established nurse in that unit, they kind of fall into 2 categories. The one that really don't care what gender you are, as long as you're doing your job. And the ones that kind of still maybe push back a little bit. It's getting to be less and less.
And then what about from a patient perception of, maybe, I don't want a man to be my nurse, or have you had any experience with that?
I have no idea how many patients I have directly cared for in all these years. I can probably think of 2 times, 3 times. And I don't even know that it was because I was a man. I think it was more personality driven. But they might have said, oh, I want a woman. Can I have a woman help me with this? Now, of course, there have been a couple times when I've had patients that were a little, they wanted me to be their nurse. They wanted me to start their IV and give them their meds and tell them a joke. But like for their EKG or their Foley or something, like, is there a woman that could help me? I need to go to the bathroom or something like that. And with an older woman, you know, I appreciated that, and I wanted to make sure they were getting what they needed. But
okay, so overall, really not a whole lot of pushback that you've experienced. And what do you say to your male students when they take care of a female patient, for example? Do you kind of prepare them that there might be some, you know, something that comes up, or do you just kind of let it go and then see where it takes you?
You know, I really don't. I just kind of let it go. And then whenever that, because what I don't want to do is kind of bake the problem into the cake. You know, if I say, hey, when you go in there, you might see this. And it seems like every time you do that, they absolutely see it. So I just kind of wait till they come out and say, oh, she didn't want me talking to her. And I'm like, well, okay, let's talk. Let's look at it from her point of view. How old is she? What's going on? What did you say? What did you do? And I kind of take it on a situational level as opposed to making it the systemic thing that all women are not going to want you to help. Because again, that makes for a rough day for all the people around you that, you know, that have to take up your slack, or you have to take up their slack. So. Yeah.
And I find too, I've found over the last several years that we have a lot more male students coming in, which I think is great. And it's such a great variety too, especially, you know, we get a lot of different people with different backgrounds. So I'm learning a lot about cultural stuff and about, you know, male and nursing too. And I really actually enjoy that because I think we need more mix of people, because not only do we have different genders, but different personalities. And like you said, I know you're the king of telling jokes and making people laugh and all that. And so everybody kind of has something else to bring to the table. And so whether you're male or female doesn't really matter, right?
Right. Now, one thing that I did notice, and it's doesn't hold, again, not, you know, anytime you make all generalizations, including this one, are typically false. The one thing is kind of a perspective thing on the point of the nursing student. You know, most guys come into nursing and they look at it almost like they're a mechanic. You know, there's a problem, you fix it. There's an issue, find the root of it, fix the problems. A lot of women come into it from a kind of a caring, helping, healing kind of, you know, oh, you feel bad, let me help you. And that involves these steps. And it sounds like kind of a subtle difference, but it really kind of colors how we provide that actual care at the bedside. And, you know, they both work, you know, they absolutely both get to the same place. You just need to kind of know yourself, know what your perspective is. And if it's not working with your patient, then try something different. But a lot of younger male students, you know, sometimes you got to kind of look, so what are you looking at? Is this a problem you're trying to fix, or are you trying to kind of solve the whole situation? So.
And that's really when, you know, the guidance of the clinical instructor, I think, is so important, right? Because in the very beginning, the students, they try to compartmentalize things. They try to do like one step at a time, kind of go by the skills list, right? They like, okay, what do I do first? And then what do I do second and third? But really, eventually you need to be able to look at the whole picture. While nobody expects you the second week in nursing school or the first clinical rotation, we just kind of want to see that growth that happens over time. Eventually you'll kind of get that whole picture. So that's something that I enjoy also. So what advice do you have for these students that might be graduating? What out there that you wish you would have known as a new grad?
Wow, there's a lot there. I think if I had one thing that I wish I would have known, it would have been more of what my trajectory would have been after nursing school. I didn't think much past graduating nursing school and getting a job. Like I said, this was a retirement gig whenever I got out of the Navy. And if I had a kind of seen how things were going to progress and where I was going to go, I probably would have taken a month off and got right back into school and just continued continue, you know, getting further degrees and postgraduate degrees, whatever, while I was still in the habit of being a student, because that's a real easy habit to get out of. Man, it takes all of about 15 minutes to not have to write a paper anymore, and you don't ever want to write them again. And I think I would have kept that going. The other thing that I always tell my students, I told my preceptees whenever I was precepting in the emergency department, is that you are without a doubt the most important patient you are ever going to neglect. You know, you have to take care of yourself. When the plane, you know, when you're getting on the plane to fly someplace, back whenever everybody was flying all the time, and the stewardess says, you know, when in the event that the cabin decompresses, put the mask over your mouth first before you help the wife and kids. There's a reason for that. And if you're not taking care of yourself, you're not going to be there to take care of your teammates and your patients. And you need, it's not an option. It's not a nice to do. It's not a, hey, maybe if you have time, you need to make the time to take care of yourself. And sometimes when you're telling a 20-something-year-old that just got out of nursing school and is going to take over the world in a minute, when you're telling them that kind of stuff, it's kind of hard to impress upon them. But it's important.
What does this self-care look like for you?
Oh man, you know, I live in the middle of a forest, and I spend as much, I mean, for me to walk out to the mail, it's a walk in the woods just to get to the mailbox. So I spend a lot of time in the trees. I've got a zillion redwood trees. I've got a beach, you know, down the hill, not too far. I spend a lot of time at the beach, play a lot of guitar. I read, meditate. I have a little woodworking gig that I do, just making cigar box guitars and just little things to kind of keep myself busy.
So a lot of nature involved there, right?
Oh yeah, we moved up here for a reason. We love it up here in the woods.
That's amazing. I like to emphasize that too, because, you know, nursing school is really busy, right? And you just get so caught up between studying, going to clinical, prepping for this, going to class, doing that, whatever. There's not even enough time in the day to really do anything for yourself. But self-care, like you said, you know, you can't take care of anybody else unless you take care of yourself first. And
absolutely,
you know, like go around the block, walk around the block for 5 minutes, 10 minutes, get that fresh air, get some oxygen to the brain, and you'll feel refueled in no time. So I like to impress upon that too. And what a wonderful surrounding that you have there with all those trees and stuff. I'm really envious looking out your window there. It's quite impressive. Good for you. And what is your most memorable patient interaction?
Wow. I have had so many. I can think of two. You know, there's all, it's, when you say memorable, that can be positive, that can be negative. The two that come to mind, I had someone, it was, and what's funny is I can't remember, you know, you think about that. And I can't remember a lot about the first one I'm thinking about. I can't remember a lot about the day. It was a Saturday. And I was precepting a great emergency department nurse. His name is Nick Brown. And we had a patient come in. You know, you're precepting, so the charge nurse is always trying to find you good opportunities, or you're kind of keeping one ear out towards the radio, trying to find good opportunities to steer your preceptor into. And there was a stroke code coming in. And so we took it, and it turned out to be someone that was very close to me. That just totally blew me away when I found out who it was. And fortunately, it had a pretty good outcome. You know, we still, you know, every year on the anniversary of that stroke, you know, still send a text and try and talk a little bit. And so that was a good outcome to a horrible situation. The other one actually involved you. And really? I don't remember a lot about it. Yeah, you were on nights, and I relieved you one morning. You had a patient that got CPR for a while, and return of spontaneous circulation, all that stuff. You turn the patient over to me. I was waiting for a unit bed, an ICU bed, and the patient ended up needing a little more CPR. Finally got her over to the unit, and in the emergency department, you know this as well as I do, but a lot of people may not. We very, very, very seldom get to see the outcome. You know, we might hear about it. Hey, that patient that you had 3 weeks ago, did you hear this? And so I remember it was probably about 9 o'clock, 8, 9 o'clock. It was still early in the morning by the time we'd finished. Finally got the patient safely over to ICU. And end of the day, I can't remember anything about the day, but end of the day, I had another unit patient, and I was really kind of frustrated because it's like 6:30 and I needed to get the patient over the unit, and night shift wasn't coming out. And it's like, I really don't want to do this. I want to go home. So I take the patient over, turn over, and I'm talking with one of the nurses, and another ICU nurse came by and says, hey, did you see your patient from this morning? And I'm like, what do you mean? Yeah, and the patient that she was in there eating sandwiches and just having and I was like, oh my God, I expected them to be intubated and, on drips for another day or so, but she was eating and taking orals, and I was like, my God, she's going to discharge. And I was like, that was such a great experience. I've never had that happen before. And that was really, really, yeah, pretty cool.
Wow. So, another life saved. Those are the stories that'll stay with you. That's right.
Yeah, that was pretty cool. And to, I'm sure that between the two of us, we have done that same exact thing. I have no idea how many times, but to see talk to him and have her say, wow, sandwich tastes pretty good. I didn't think I was going to get to eat anymore. And I was like, oh my God, that was pretty cool. I enjoyed that.
Wow, that's amazing. Yeah, those stories, some of those will stick with you forever. I definitely have those as well. So Jim, any other words of wisdom for new nurses or people that are in nursing school?
All I can say is have fun with it. There are more nursing jobs out there than you can possibly imagine. And no one expects you to go down with a sinking ship. If you're not happy in what you're doing, find another job. Find another place in nursing or in healthcare in general that works for you. I've actually taken over a position as the director of the phlebotomy program up here. It's like not nursing, but it's still healthcare related, and it's there's plenty of opportunities for nurses. The other thing, I would just say, practice. We get so wrapped around the axle about, especially when they're still students, and this is geared mostly towards students. And it's like, practice doesn't make perfect. Practice makes permanent. So before you start doing something over and over and over again, make sure you're doing it right. Make sure you have the right steps and you practice that perfect skill perfectly. And that's what's going to give you that muscle memory. That's what's going to make things happen kind of automatically whenever the time comes and you need to kind of do that fine motor stuff. But yeah, practice doesn't make perfect. It makes permanent. So that's all I got.
You always had a lot of good sayings, so I'm going to have to go back to the video and put that in the introduction, all your little quotes that you put in there.
Oh.
All right, so thank you so much, Jim, for joining me. I really enjoyed this conversation. Thanks for sharing your work, Jim. And your students are lucky to have you. Thanks so much.
Thank you so much, Petra. Thank you for what you do, because like I said, my students, they dig your videos, and it's good seeing you again. Nice talking with you.
Absolutely. Thanks so much, Jim. Have a good one.
You too. Be well.